Okay, so many thanks, Luciano, and many thanks, Jacques, for this very positive assessment of what we're doing in ESTHER. So my brief is to talk about the importance of institutional health partnerships. And I wanted to start with a very personal experience that I had as a medical student. When I went to Ghana for an elective, and you see me there, and this is the Presbyterian Hospital in Agogo in Ghana near Kumasi. And this experience, these 6 months, were perhaps life-changing, but very important for me personally, because it made me realize many, many things about health and global health, and it also initiated my scientific career. You see this little table on the slide. This is a randomized controlled trial of cotrimoxazole against placebo in patients with Buruli ulcer, which is still today a problem in that region in southern Ghana. And you perhaps also noticed the sample size, which is not exactly state of the art, and I still had a lot to learn, but it was a fantastic experience. At the same time, I think it was also a less than ideal program. I was ill-prepared. I didn't know the language. I was put in charge of a department immediately. Basically, I was treated like an experienced doctor. And I was a medical student with very little experience and also little knowledge of the diseases that were prevalent in that area. So it was a very good experience for me, but it lacked the reciprocal nature that nowadays is essential in these educational programs, and many other standards have since been developed. And also it lacked sustainability. It doesn't exist anymore, this program. So this is not really an institutional health partnership, what I experienced in Ghana, but it shares some of the issues with institutional health partnerships. So what are institutional health partnerships? They're long-term institution-to-institution partnerships that typically focus on capacity building, clinical service delivery, and operational research. And the long-term peer-peer support is a very important element of such partnerships, and the overall aim is to strengthen health workforce and its institutions. Such partnerships are also extremely popular, as you see on this slide here. There are many of them. They're relatively easy to set up, and as I will show you, not all of them out of Switzerland are part of ESTHER. I'll get back to that. Now, the World Health Organization, and yesterday at the meeting of the ESTHER Alliance, we had several representatives from WHO. They also recognize the potential of institutional health partnerships. It's this pillar here, partnerships for improvement. So these partnerships can provide an opportunity for learning from frontline activity to continuously shape broader national and international efforts to achieve universal health coverage. So partnerships are an important element within the drive towards universal health coverage. And of course, they are an important element of the SDGs, as Jacques already mentioned. SDG 17, of course, is all about partnerships, and several of the sub-aims, I just picked 3, are extremely relevant to what ESTHER is doing. Now, yesterday, Thomas O'Connell from the World Health Organization, the Department of Health Systems, Governance and Financing, reminded us that there is a distinction between support and strengthening. Support is really something pretty short-term, and it's this sort of superficial layer on this cube on the slide, whereas strengthening is really about permanently making the system function better, not just filling gaps or supporting the system. And of course, what we should be aiming for in our institutional health partnerships is really to strengthen systems rather than providing short-term support. Now, do these international health partnerships work? The ESTHER Alliance has, and David, who is here, was actually one of the co-authors, has done a systematic review on the evidence that exists on the effectiveness of institutional health partnerships. And they used a system where they graded, if you like, studies or reports according to 5 levels, from expert opinion, advocacy, to systematic review, or level 4, replications, etc. And I wasn't surprised to see that, first of all, there were relatively few such reports or studies, and secondly, that really most of them were at a low level of evidence. So 0, 1 or 2. So 2 includes data that shows change, but attribution not proven. This is not surprising. It's very difficult to do randomized controlled trials in the context of institutional health partnerships. These are complex interventions, and they don't lend themselves easily to randomized controlled studies. Now, the conclusions from this systematic review, basically, unsurprisingly, evidence for the effectiveness of institutional health partnerships is thin, both in terms of quantity and academic rigor. And there is a whole research agenda which comes out of this work, which basically says we need to better define and differentiate different types of partnerships. We need to be able to measure and compare effectiveness across such different partnerships. We need to measure this partnership at different levels, at the level of the individual partnership, the bodies that facilitate programs, and at the level of health service delivery. And there's a need to develop indicators and frameworks. And of course, ESTHER Alliance since then has developed such frameworks and indicators. Now, yesterday, Thomas showed this cartoon, which I think is important in this context. I think we can all agree that the theory is correct. We have numerous case studies of institutional health partnerships that work. So we know it can work, and sometimes it doesn't, but the theory, the approach is sound. And we should keep that in mind when we read papers about the lack of randomized trials in the context of institutional health partnerships. Now, what can we do concretely in the Swiss ESTHER initiative in order to make sure that the guy makes it to the other side? And I think we have several tools that can help us to make sure this happens. And these are sort of briefly summarized on this slide. The ESTHER partnership programs, the common approaches tackling diverse problems, and particularly the partnership quality principles are incredibly important in our work in ESTHER Switzerland. We are also aware of the THET principles which we think are extremely useful, and of course we orient our activities towards the European ESTHER Alliance Charter, the quality of partnership principles that the ESTHER Alliance has defined. And later today we will hear about the ESTHER Effect tool. The self-assessment version is shown here, and Claudia will talk about this, which again we think is an excellent initiative to develop quality, assure quality. So ESTHER Switzerland is really two people, Susanne Amsler from the SDC and Luciano, whom you all know, but also very important, the International Steering Committee, which helps us to select projects, and not shown on this slide, the many reviewers, international experts, 3 for each proposal, which look at the proposals according to the criteria that I showed on the previous slide. So we really, when we select our proposals, are very much focusing on quality, impact, and sustainability. And as I said, we have now 3 experts, all international, and actually it's quite easy to find these people. They're quite willing to help us and give an opinion on a proposal. So all the projects are not only reviewed, they all get feedback, and if they are successful, they often need to revise their proposal in order to get funded. So this is quite a serious process, and I hope, and we'll see that later today, that it works and produces proposals and projects that are successful. And here on our website is the list of proposals that we fund at present. And another important initiative, of course, and Luciano, thanks very much again for organizing this, is the ESTHER Forum, where we bring people together to exchange their experiences, and we heard about the speed dating that will take place this afternoon. So let's not forget, partnerships happen. And I just did a little search on the web and looked for partnerships. And I found, within minutes, I found 10 or so, and I didn't recognize them. They were not ESTHER partnerships. So they happen, even the Hirslanden clinics are involved in such partnerships, and many others. And it's happening anyway, so ESTHER basically attempts to make the best possible projects happening and to assure quality in these partnerships. And lastly, I think ESTHER Switzerland is also important for advocacy. We need to explain to the Swiss public what development cooperation is all about and why it is important. And these partnerships provide examples of good practice that people can understand. So I think this is also an important strength of the ESTHER initiative. And with that, I conclude, just show you the website again and hand over to Luciano. Thank you.